So welcome, this is Diabetes Basics, and this webinar is designed to provide you with a basic understanding of diabetes, how to manage blood sugar levels to prevent diabetes complications, including vision loss, and the availability of accessible resources. This really is kind of an overview because the plan is to do some other webinars that go more deeply into some of the things that I'm talking about, but I love to start with a basic understanding and overview of diabetes because I never want to assume that everybody knows what diabetes is because there are a lot of misconceptions out there about it. So giving you a broad understanding of it in more and in simpler terms that everyone can understand, hopefully will help you understand where I'm going with all the other presentations that we plan to do. All right, so basically, diabetes is actually called diabetes mellitus because there's actually another type of diabetes called diabetes insipidus, and that is completely different. It's a pituitary gland disorder. So, what we're talking about is diabetes mellitus, but of course, most people just call it diabetes. For anyone that's going to be on Jeopardy one day and you want to know what the word means, diabetes mellitus refers to the symptoms of diabetes from the Greek diabenum, meaning to pass through. That describes the copious urination that happens with diabetes. And mellitus is a Latin term meaning sweetened with honey, which refers to the sugar that is in your urine when you have diabetes. So there you go. If you get Final Jeopardy and that's the question, you owe me like 10% or something for giving you the answer. Got it. All right. So technically, diabetes is defined as a chronic disorder of carbohydrate metabolism resulting from inadequate production or utilization of insulin. In simple terms, it basically just means you have high blood sugar. So with diabetes, you have an organ in your body, the pancreas, which is located below and behind your stomach. One of the main duties of the pancreas is to make insulin. So insulin is a hormone. The basic role of insulin is to enter your bloodstream and allow entry of sugar that's in your blood to enter your cells where it is used for energy. So when you have diabetes, your pancreas either doesn't produce enough insulin or either your body cannot use the insulin that it produces for various reasons. And we'll go a little bit more into that and hopefully it will all make sense. All right, so there are different types of diabetes. Type 1 is actually an autoimmune disease. So that means that for some unknown reason, your body attacks your pancreas, thinking it's like an invader. So your immune system attacks your pancreas and it attacks the beta cells that produce insulin. So as a result, your pancreas does not make insulin. So if you have type 1 diabetes, you have to take insulin shots every day to survive. Type 1 used to be known as juvenile diabetes and also child onset diabetes, because usually it was diagnosed when someone was young or a teenager. But now it's actually, some adults are actually getting diagnosed with type 1 diabetes. But type 1 only accounts for about 5% of diabetes cases. So it's still kind of rare. Type 2 is the most common type of diabetes. This used to be called adult onset diabetes or non-insulin dependent diabetes. Now it's just called type 2. With type 2, I like to say, how I word it is, the pancreas is tired. So basically, the pancreas kind of wears out because it has been producing more and more insulin as your body has been trying to move the sugar into your cells, but your cells are insulin resistant. So when that happens, your pancreas says, oh, the sugar is not getting into the cells, so I need to make more insulin. So what happens is it makes all this insulin and it's not being used, and the pancreas finally gets tired, so it doesn't work as efficiently as it should. So type 2, when you first get diagnosed with it, usually you can control your blood sugar with lifestyle changes like counting carbs, healthy eating, getting exercise, losing weight. Because the less body weight you have, the less your pancreas has to work. Because if you think about it, the less body surface area you have to move blood through. So, but eventually with type 2 diabetes, your pancreas does eventually tend to give out. So, a lot of people with type 2 diabetes end up having to take insulin shots. That doesn't mean you're doing something wrong and you're a bad diabetic. It just means that your pancreas has finally gotten to the point where it's just not efficient anymore. So, you need to give yourself some insulin to make it better. So, I'm going to talk a lot more about medications on another webinar. So I'm not going to get into that a whole lot, but there are a lot of processes involved in diabetes. One is the liver. The liver actually stores sugar, and it has a role in releasing sugar when your blood sugar goes low. So some medications actually act on the liver, and then some work in the gut, and then others work on the kidneys, and there's all different types of medications. So that's just there's a commercial for a future webinar, so you will come in and learn more about that. All right, so that's type 2. Like I said, it's actually the most common. So most of the things you hear about are about type 2 diabetes. Gestational diabetes is diabetes that happens in pregnancy. It usually develops in the 24th to 26th week due to the increase in body mass due to being pregnant. That's a stressor on your body. So if you have the genetic component to develop type 2 diabetes, usually gestational diabetes will rear its head at that time. So, you might be put on metformin, or you might be put on insulin shots while you're pregnant. Usually after delivery, and you lose some of the extra weight that you had, usually the diabetes goes away. So you don't have to be treated for it anymore. However, just the fact of having gestational diabetes greatly increases your chances of becoming a type 2 diabetic later in life. So, you want to make sure that you continue to get checked for diabetes as the years go. All right, there are other types of diabetes that only account for about 1%. These are kind of new forms of diabetes that you probably haven't heard a whole lot about. One is LADA. They also call it diabetes type 1.5. LADA stands for latent autoimmune diabetes in adults. Basically, it's someone that develops type 1 diabetes later in life. The hard part about this one is usually when you're later in life and you develop diabetes, doctors assume that it's type 2 because that's usually how it was. And adults are usually the ones that get type 2. So, they're treating you for type 2 and maybe giving you medications or lifestyle changes, and your diabetes isn't getting any better. So then they can do testing to test for antibodies to see if it is type 1 diabetes, and then you get put on insulin. So sometimes if you develop type 2 diabetes and you're doing everything right and your diabetes just is not getting any better, you can ask your doctor, hey, you think maybe I have 1.5 or something, can we test and see? And then, that might be the answer to why your diabetes is not improving. The other types are genetic, neonatal diabetes, and maturity onset diabetes of the young. These are very rare, but it has to do with genetic defects. However, whatever type of diabetes you have, you basically treat them all the same way. So we're going to talk a little bit about that as well. All right, there also is another term you've probably heard called pre-diabetes. This is a term used for people whose blood sugar levels do not meet the criteria for diabetes, but whose levels are too high to be considered normal. So basically, pre-diabetes is a warning sign that if you do not change your lifestyle, such as losing weight, eating healthier, controlling stress, getting exercise, you will develop type 2 diabetes. So anyone that is told they have pre-diabetes, that's the only time that you can prevent getting type 2 diabetes. But once you have type 2 diabetes, there's no going back. You can control your type 2 diabetes, but you can't ever go back to not having diabetes. So, I hear a lot about people saying they cured their diabetes and so on and so on. There's really no such thing. Diabetes is damage to the pancreas. As of right now, we don't have any way to repair the damage to the pancreas. unless you get like a pancreas transplant, which is not real common. So if you have diabetes, you know, even if you control it and your blood levels go back down to normal, you still have diabetes. That's the point I was trying to make. So please don't fall for all those ads that say they can reverse your diabetes and things like that. All right, so how is diabetes diagnosed? Basically, you know, when you go to the doctor, you know, they ask you about any symptoms you're having or any concerns that you have. So it's by symptom assessment. So some symptoms of diabetes are you're hungry all the time, you're thirsty all the time, you have to go to the bathroom all the time. Those are like the classic symptoms of diabetes. So if you complain of those things and your doctor does a lab test, that's when they come up with the diagnosis of diabetes. So there's different lab tests that the doctor can do. One is a fasting glucose test. So that is a test, they usually do it in the morning and you haven't eaten anything after midnight the night before. So they want to see what your blood sugar level is with no food in your body. So a person without diabetes that gets this test done, their blood sugar level would be less than 100. They measure it in milligrams deciliters, mg/dcl. That's just kind of the what they've come up with how to measure it. So don't worry about that. Just worry about the numbers. So normal would be less than 100. Pre-diabetes would be 100 to 125, and then diabetes is 126 or higher. So they usually don't diagnose you just with one test. They usually do a fasting and then they'll do another one maybe a week later or a day later, or they'll do a fasting and a random. So with a random, if you are normal and do not have diabetes, your random glucose test, which means you could have eaten, and then you go to the doctor and they draw your blood or prick your finger or whatever they do, you want it less than 140. Pre-diabetes is 140 to 199, and it's considered diabetes if your random blood test is 200 or higher. There's also another test called the hemoglobin A1C or A1C. This is really kind of the gold standard because I tell people you can't really cheat at this test. You know, I've known people that have tried to cheat at their fasting tests and their random tests by, you know, eating oatmeal before they go and drinking lots of water and trying to dilute the results. It is possible those things could affect what your test is. However, with the A1C, none of that works for cheating because what this blood test measures is the amount of sugar attached to the hemoglobin of your red blood cells. And red blood cells live for about 3 months in your body. So basically, this test is showing the doctor what your average blood glucose levels were over the previous 3 months. This is measured in a percentage. So A1C test, normal would be less than 5.7%. You're considered pre-diabetes if it's 5.7 to 6.4%. And you are considered to have diabetes if your A1C level is 6.5% or higher. Now, once you're diagnosed with diabetes, the number that I want you to remember is 7. You want your A1C to be below 7% because studies have shown that if you keep your blood sugar levels at 7% or below, that's when you can prevent complications from diabetes, which I'll talk a little bit more about in a few minutes. All right, so pre-diabetes, I briefly talked about this again, but just so you know, if you're considered pre-diabetic, your A1C is 5.7 to 6.4, and fasting blood sugar levels are 100 to 125. That's when the doctor hopefully will say, you know, if you come up with pre-diabetes levels, hopefully they'll give you some counseling about, you know, if you don't change some things and we get these levels down, it's going to turn into type 2 diabetes. So here's what you need to do, meaning healthy lifestyle, eating healthier, exercise, you know, stopping smoking, just adopting a healthier lifestyle, controlling stress, things like that to help get those levels down. All right, so diabetes really is very prevalent in the US. According to the CDC, these are 2020 statistics, 34.2 million Americans, which actually is just over 1 in 10 Americans have diabetes. 88 million, approximately 1 in 3 people have prediabetes. So I guarantee everyone on this call, you either have it or you know someone who does, because that's how prevalent it is. So, the things that we talk about with diabetes, it really is the way everyone, regardless of whether or not you have it, should live. We all should strive to live as healthy as possible to help prevent and manage chronic diseases. So even if you're on this call and you don't have diabetes, pay attention, because you might learn something to help you just in your normal life. All right, so symptoms of diabetes. I talked about them just a little bit, but basically it's frequent urination, excessive thirst, unexplained weight loss. That's usually with type 1 diabetes. Extreme hunger, tingling or numbness in the hands or feet, sudden vision changes, feeling very tired much of the time, very dry skin, sores that are slow to heal, more infections than usual. Now, diabetes is really insidious. Type 2 is the most insidious. Usually type 1, the symptoms are pretty profound. So you end up going to the doctor sooner than you would with type 2. But with type 2, you can always blame, it's like you always can find a rationalization for the symptoms that you're having. I'm a nurse, and it's universally known that nurses are like the worst patients. So just full disclaimer. So I have type 2 diabetes. I was diagnosed about 13 years ago. So before I was diagnosed, I was having all these weird symptoms, and it was always like, oh, I'm just tired because I'm a single mom. Or, I'm going to the bathroom all the time because I'm drinking a lot, and I'm drinking a lot because it's hot outside and I'm dehydrated. So, it's really easy to kind of brush off the symptoms of diabetes. It wasn't until I actually passed out and then finally went to the doctor, and he was like, oh, you have diabetes. And I was like, wow, now all those symptoms I had make a lot of sense. I was 35, so I was like, I'm too young to have diabetes and all that stuff. But, it was at a point in my life where I was very unhealthy. I was really overweight, and I didn't exercise, and I was stressed to the max, and I was a single mom. So that's kind of when diabetes type 2 kind of shows itself. There is a genetic component to it. Like almost everyone in my family has diabetes. So, I pretty much had the genetic components to get it. And then when I had such an unhealthy lifestyle, that's when it reared its ugly head. So just know, it's important to get a physical when you can, and to get screened for diabetes, especially if you have a family history of it. It kind of is a standard now that when you reach age 45, everyone gets screened for diabetes, because that's kind of around the age when it starts showing up. And because it's so prevalent in America, the healthcare industry really is trying to get ahead of it now, which I think is a wonderful thing. All right. So why is maintaining blood sugar levels so important? Well, the main reason is to prevent complications. Everything we do for diabetes management is to maintain our blood sugar levels to prevent complications, because it is the complications of diabetes that cause illness and death. Those are the things we're trying to prevent. So, how does diabetes cause complications? Well, here's the simple answer. Sugar is actually an irritant when it's in the bloodstream. So when sugar stays in our bloodstream because we do not have enough insulin to move it into our cells, it causes damage to our blood vessels and nerves. And this leads to organ, muscle, and cell damage. So controlling your diabetes means preventing complications. All right, so now I'm going to talk a little bit. Well, I guess I'll stop for a minute. Melanie, I just wanted to make sure, are there any burning questions in the chat that I need to address before I get into something else?
I'm sorry, I couldn't get my
That's okay.
microphone to unmute.
That's okay.
No, we don't have anything yet. So
I'm going to take that as I am answering everyone's questions before they even have them. So I'm going to continue on. All right.
There you go.
So diabetes complications. Usually when I have a slide for diabetes complications, I really just have a picture of the whole body because diabetes affects everything from head to toe. The number one complication of diabetes is cardiovascular disease. Actually, when you have diabetes, you're about 2 to 3 times more, you have 2 to 3 times more risk of having a heart attack or stroke. So the number one complication of diabetes that causes death is cardiovascular disease. So it's very important not only to manage your diabetes, but also to prevent cardiovascular disease and manage it if you have it. It is very rare that I meet someone with diabetes that does not also have high blood pressure. They usually tend to go hand in hand because they pretty much have the same risk factors. TMI, I'm an open book. So I have high blood pressure and diabetes. So I have to pay attention to both of those things. So if you have that, just know you're in good company and we'll make it through. All right, other complications, diabetic eye disease. So diabetes is also the number one cause of blindness in adults, and that's due to diabetic retinopathy. I do work in the vision field, and there are a lot of clients that I help that actually find out they had diabetes when they have vision loss. They'll go to the doctor because their vision is starting to decrease, or they have like a retinal detachment or something. So they go to the eye doctor, and that's when they find out they have diabetes. So, not only are you dealing with the vision loss, but now you're dealing with this chronic condition, and knowing that you might have been able to prevent your vision issues if you had known you had diabetes and managed it. 1 in 3 people with diabetes tend to end up getting diabetic eye disease, diabetic retinopathy. So it's very prevalent, but also know that it's so important to get an annual dilated eye exam because about 95% of the cases of blindness with diabetes can be prevented because an eye doctor can pick it up in a dilated eye exam in an early stage. So I know it's difficult because a lot of people do not have vision insurance. I'm one of those, but let me see, I just got my eye exam done and I paid out of pocket, and I think it cost me $150, which is a lot of money. But, I just know that it's very important to get my eyes checked to get ahead of something like that. So, just know the importance of that to help keep your vision and to prevent any further damage if you currently have vision issues due to diabetes. So another complication is slow healing wounds. Usually circulation is affected with diabetes. So if you get a wound, especially in like your feet, you don't get as much oxygen to the tissue. So it tends to not heal as quickly as it would in someone that does not have diabetes. The slow healing wounds tends to end up with, if your circulation is real poor and it's not healing, sometimes that infection will spread to your bone, and that's called osteomyelitis. And that's a very serious infection. And that usually is what happens with lower extremity amputations, just because there's no oxygen for the tissue to heal. So they end up having to amputate. Usually it's like they amputate your toe, and then if you get another wound, they end up, continue to amputate to the knee or even the hip. That's a very serious complication of diabetes. Other complications are infections of the kidneys, skin, and bladder. Also bladder dysfunction, gum disease and gum infections, sexual problems, kidney failure. Diabetes is also the number one cause of kidney failure. So most people that are on dialysis are on it because of complications from diabetes. The other reason people usually are on dialysis is because of high blood pressure. So remember, I said usually people with diabetes tend to usually have high blood pressure as well. So if you have both of those, that even increases your chances of kidney failure more. Another complication is gastroparesis. This is when kind of the nerve endings to the stomach don't function like they should. So you have digestive issues, meaning your stomach is very slow to empty. So it causes a lot of GI upset. If you have gastroparesis, they usually want you to eat like 4 to 6 very small meals a day to give your stomach the time to work on the digestive process. And, there's certain foods that you want to avoid. You want foods that maybe will digest faster than other things. But if you are on gastroparesis, that's when you really need to meet with like a dietitian to get a specific diet that will help control the symptoms of that. Another diabetes complication is neuropathy, and this is when you have nerve damage, mostly to your extremities. It mostly happens in your legs, but also can happen in your hands. Neuropathy is when the nerve damage, and it tends to cause neuropathic pain, which is nerve pain. And that's when you get kind of, I don't know if you've ever had like your arm fall asleep and you get that pins and needles feeling in your arm. It's kind of like that, but a little bit more severe. And it's really hard to treat. It's hard to treat nerve pain, but there are some medicines like gabapentin is probably the most popular medicine that they put you on for that, to help with the pain. But also you have decreased sensation to your lower extremities. So that's why I don't know if you've ever heard that you should always wear shoes when you have diabetes, even when you're in the house, because if you have neuropathy, you could step on something in your house and not know it because you didn't feel it. And then if you have a vision impairment on top of that, you can't see that you stepped on anything. So it's very, very important when you have diabetes, especially if you have neuropathy, to do a non-visual or visual inspection of your feet every day. So probably do it at the end of the day so that you catch something early if you happen to step on anything. Basically, if you have enough vision, visually inspect your feet. You want to look for any punctures or cuts or, red areas or bruised areas, anything like that. But if you don't have enough vision to do that, make sure you take your hand and you feel around your toes, in between your toes, your heel, all parts of your foot, just to make sure there's nothing in there. I don't have neuropathy, but I did in my own house. I stepped on a piece of glass and it was so tiny that I didn't actually realize it till like 2 days later is when it embedded in my foot. And, it wasn't a fun process. I then had to go to a podiatrist and they had to cut open my foot and dig the glass out. And then I'm on crutches. It's not fun. And if I had done my foot inspection like I was supposed to every day, I could have saved myself a lot of pain and misery. So don't be like me and have to learn from the school of hard knocks. Just, check your feet last thing before you go to bed. So another complication is foot ulcers. And that also happens from, getting a wound on your foot or poor fitting shoes. It's very important to wear shoes for comfort, not fashion, if you have diabetes. That was also a hard lesson for me to learn because I always wanted to be a fashionista, but now I wear boring, wide shoes that are comfortable. And if I have shoes and I take them home and I put them on and they hurt my feet, I take them right back to the store. Luckily, shoes are getting a little bit more fashionable, or either I'm just getting older and don't care about being trendy anymore. But just make sure, you have wide shoes, that there's no pressure on your feet that could rub and cause an issue like a foot ulcer, because that just starts down the path of infection and things like that. And that's another thing that's easily prevented. And then I already talked about lower extremity amputations as a complication of diabetes. All right, so diabetes and the eyes. So diabetic eye disease is a group of eye problems that can affect people with diabetes. These conditions include diabetic retinopathy, diabetic macular edema, cataracts, and glaucoma. So over time, the extra sugar that sits in the bloodstream causes damage to your eyes, and that leads to poor vision and blindness. Retinopathy is actually damage to the blood vessels in the retina in the back of the eye, and it is the most common eye complication and the most likely to lead to blindness. As the eyes attempt to circulate more blood to compensate for the damaged blood vessels, It actually forms new blood vessels, but they are abnormal and very fragile. So these new blood vessels break and they leak blood and cloudy fluid into the eye. If untreated, all of that leakage blurs your vision and eventually leads to blindness. So it's very important, if you notice vision changes and you have diabetes, to get to an eye doctor for an exam as soon as possible, because if it's caught early enough, they can stop the leakage and hopefully you can retain most of your vision. You might lose some, but you'll be able to retain a lot more than if you wait. Cataracts are clouding of an eye's lens, and just having diabetes just greatly increases your chances of having cataracts as well. Glaucoma is an increase in the fluid pressure inside the eye, and that leads to optic nerve damage and loss of vision, and that's kind of the same thing. Just the irritant of the sugar in the blood vessels, the small blood vessels that lead to the eyes, makes you more prone to getting glaucoma as well. Once again, glaucoma is something they test for when you get a yearly eye exam. That's when they, put the puff of air in your eye and they check the pressure. So that's also important to get diagnosed early so that you again can prevent any further damage. So if all those complications are not bad enough, diabetes also increases your risk for cancer of the liver, pancreas, bladder, endometrium, colon, rectum, and breast. Increases your risk of foot ulcers. It also increases your risk of dementia, hearing impairments, fatty liver disease, and pancreatitis. Also, psychosocial emotional disorders like anxiety, depression, eating disorders, and schizophrenia. You can imagine just living 24/7 with a chronic disease, any chronic disease, but diabetes, because it has so many complications that can occur from it, and you have to stay so vigilant, 24 hours a day to help manage your blood sugar levels. A lot of people that have diabetes suffer from anxiety and depression. So, that can put you in that vicious cycle of, I don't want to manage my diabetes because I'm too depressed, or it causes too much anxiety. So you have all of these stages in the cycle that you need to pay attention to, and it can be emotionally draining. So it's important, at any time, and especially if you have diabetes, if you're suffering with anxiety or depression, to get some help, because it's hard enough. So you don't need anything else to complicate the process. If you have type 1 diabetes, remember that is a immunocompromised condition, autoimmune condition. Having type 1 also increases your risk of developing other autoimmune diseases. These are things like celiac disease, thyroid disorders, adrenal insufficiency, myasthenia gravis, gastritis, and autoimmune hepatitis. All right, I'm just going to check one more time, Melanie, and see if there are any chat questions.
It looks like, let me double check, but I think we are still, my screen's doing funny things here.
That's okay.
Let's see, we do have someone had said they've had diabetes for a year now. It's not until now that they understand what's going on with their body. This is very thorough. Thank you.
Well, thank you. I'm glad to know that I'm helping out, because it is a
Yeah.
lot to know. I literally could talk about diabetes 24 hours a day and spend 3 days and still not be done, because I'm a diabetes nerd apparently. But it's such a multifaceted disease, and it affects so many things in our lives, and it can be very complicated. So I'm really trying to do my best to simplify things. So just know, if I cover something and you still don't quite understand it, when we open up for questions, please feel free to ask that question, and I will do my best to explain it in a way that it's understandable. Sometimes I take for granted that what I'm saying everyone understands, because I understand it, but I don't want to be that person that thinks that. So there's no stupid question. I might give you a stupid answer, but there's no stupid question. So just be aware when we open it up. Just please feel free to ask anything. And if I don't know the answer, I'll tell you and I'll get back to you. All right. So how do you know if your diabetes is controlled? Well, one thing that I mentioned is by lab values. So I mentioned the hemoglobin A1C test. This is a blood test performed at a doctor's office or a lab. This is one where they draw the blood from your arm and they send it off to a lab. Some doctor's offices have a machine in their office where they can prick your finger. It's a harder prick than when you do a blood glucose reading at home, and they take a lot more blood. I mean, it's not like an obscene amount of blood, but it's a bigger drop. And they have a machine that they can put it in, and within like 5 minutes, it'll give the doctor your A1C level. Not a whole lot of doctors' offices have that, but like endocrinologists, they probably do because they do that test a whole lot. But either way, the lab value, it would be the same whether they do the finger prick for it or the lab result for it. So remember, if you have diabetes, the number you want is 7% or below to prevent those complications that I talked about. A1C, the standard is to get it done every 6 months. So if you have diabetes, you should be seeing your doctor every 6 months to at least get an A1C level done. If your A1C is well controlled, your doctor might say, I don't need to see you but once a year. But then if it starts creeping back up, they'll want you to come back. Any more than every 3 months is just excessive, because remember, I said the red blood cell lives for 3 months. So your result is not going to be that much different if you get it done every month. So 3 months to 1 year is what you want, that is when you want that taken. There's also a way, testing your blood sugar levels at home with a meter. I'm not going to get into this a whole lot because I believe my next webinar in a couple months is going to be on monitoring your blood sugar levels and ways to do that non-visually with talking meters and continuous glucose monitors and how to help make them accessible. So I'm just going to talk a little bit about it, the importance of testing your blood sugar levels at home. Because it gives you like a snapshot of your diabetes management and provides you data for understanding what and how food, activity level, medicine, and your lifestyle affects your blood sugar levels. So, meaning like if you take your blood sugar first thing in the morning, that's a fasting blood sugar level. So you could take that every morning and you can kind of see what your baseline blood sugar is at that time. If you want to eat something and see how that affects your blood sugar level, you could eat something and then 2 hours after eating, take your blood sugar level and see what it is. You want it to be below 180. You give yourself 2 hours because it takes about that long for the insulin to start working, for your medicine to start working and so forth. I told you I'm the school of hard knocks. So, I decided to eat a cinnamon roll because I love cinnamon rolls. I'm like, I'm going to see this not going to affect my blood sugar. Sometimes living in denial is a wonderful place to live. So I enjoyed my cinnamon roll, felt a little weird, waited 2 hours, blood sugar like 364. So therefore, no more cinnamon rolls for me. But I'm one of those people that I had to prove it to myself that it's really going to affect me. So once again, please don't be like me. Be smarter than me. Carbohydrates is the nutrient in food that makes your blood sugar level go up. So the three, I might be getting ahead of myself, but if I am, I'll just repeat it when I get to that point. So just bear with me, if you will. The three main nutrients in food are carbohydrates, protein, and fat. Of course, we know fat is not good to eat a whole lot of fat for heart issues, but fat does not raise blood sugar levels. So that's one good thing about fat. Protein also does not raise blood sugar levels. Carbohydrates do. Carbohydrates are metabolized into glucose, which is also known as sugar, through the digestive process in your body. So, carbohydrates can be simple carbohydrates or they can be starchy carbohydrates. So starchy carbohydrates are things like pasta and bread, things like that, what they have sugar in them, but your body tends to digest them at a little bit slower rate. So they do raise your blood sugar level, but they tend to raise it over a longer period of time. You still should not eat a lot of them because they do raise your blood sugar level, but it's actually better to eat the starchy ones than the simple sugars. Of course, simple sugars are the things like my cinnamon roll and anything that tastes yummy, and cookies, crackers, cookies, candy. I think I said cookies twice because I love cookies, pies, cakes, things like that. Those simple sugars get digested very quickly, and they tend to raise your blood sugar level within like 15 minutes or so. But that's not really the worst thing. Kind of what happens is once your body's done with that sugar, very quickly your blood sugar is going to drop right back down because there's nothing to maintain your blood sugar level. So you're kind of going from very high to very low in a very short amount of time, and that's what causes problems. You want your blood sugar to be, I tell people, like a wave in the ocean. It's going to go up some and it's going to go down some, and that's just normal. That happens with everybody. But you don't want it to go up and down quickly, and you don't want it to stay up for a long period of time, and you don't want it to stay down for a low period of time. So everything that we try to do with diabetes management is to help maintain that wave of blood sugar so that we don't have the complications of high and low and complications of having the sugar in our system for a long time. So I get tangential sometimes, back to our blood sugar levels and testing at home. So you want your blood sugar when you test it at home to be between 80 and 130. This is when fasting, meaning no food in your system, and in between meals. If you eat, like I said, wait about 2 hours and then take your blood sugar, and you don't want it to be any higher than 180. If it is higher than 180, that is too high, and it's considered hyperglycemia, which is high blood sugar. You also don't want it to be below 70. 70 and below is considered low blood sugar, also known as hypoglycemia. So remember, I was talking about the wave. You want your blood glucose levels to stay kind of in a wave, because when your blood sugar levels stay close to normal, you feel better. You have more energy. You're less tired. You're less thirsty. You urinate less often. You heal better. You have fewer skin and bladder infections, and you have fewer problems with your eyesight, your feet, and everything else. You just feel better. So if you've ever had a point where your blood sugar was high or low and you had symptoms, just remember what that felt like, that you don't want to feel like that anymore. And hopefully that helps motivate you to keep your blood sugar more normal so that you feel better and healthier every day, so that you can live the life that you want to live. All right. So high and low blood sugar levels. Like I said, low blood sugar is called hypoglycemia. That is less than 70. High blood sugar is hyperglycemia, and that is higher than 180. So symptoms of low blood sugar, the early symptoms include shakiness, dizziness, sweating, hunger, irritability or moodiness, anxiety or nervousness, and headache. I like to feel that I coined the term hangry about 15 years ago, and now everybody's using it. I should have copyrighted it, but basically that's my main symptom that I get. I get hangry. I get hungry and I get very angry, and it's like my personality changes. So my husband knows when I start acting like that, he gets me a simple sugar to help get my blood sugar back up. Also, some people, it's kind of like you're drunk. You might slur your words and you're wobbly, things like that. So a lot of times people have been mistaken as being drunk when actually they had low blood sugar. So, that's another reason why it's so important to manage your blood sugar levels to help prevent that. I unfortunately had a gentleman who, he was a dialysis patient of mine back when I was a dialysis nurse. And actually, when I was leaving work, he was driving himself out of dialysis and going home, and I happened to be in the lane next to him, and I looked over and his eyes were closed. I thought he was just resting his eyes at the light, but he ended up not moving the car, and then the lady behind him hit him because the light turned red and he didn't move. And I get out, and he had passed out from low blood sugar. He had not eaten after his dialysis treatment, and his blood sugar had dropped. I mean, it was horrible. So thankfully he was okay. But, he learned that, he needs to eat after he gets his dialysis and have things with him and check his blood sugar before he leaves. But initially, the cop thought that he was drunk. And because I was there, I was able to say, no, that's not what it is. Why don't you check for this? And then they realized that's what it was. So that was an awful day. All right. So if hypoglycemia, low blood sugar, goes untreated, signs and symptoms of severe hypoglycemia can occur. These are things like clumsiness or jerky movements, muscle weakness, difficulty speaking or slurred speech, blurry or double vision, drowsiness, confusion, convulsions or seizures, unconsciousness, or death. So you can die from low blood sugar if you do not treat it immediately. Causes of low blood sugar: either taking too much insulin or taking too much of your diabetes medication, not eating enough, postponing or skipping a meal or snack. You increase your exercise or physical activity without eating more or adjusting your medications, and drinking alcohol. A lot of people think alcohol raises your blood sugar level, but it does not. Alcohol itself actually lowers your blood sugar level because your liver thinks it's a toxin. So your liver stops helping with your blood sugar issue in your body, and it tries to get rid of the toxin, alcohol, before it deals with your blood sugar. So it tends to drop your blood sugar level. So if you do drink, just make sure you eat something and you drink in moderation so that you do not pass out from low blood sugar. If you do happen to get low blood sugar, this is the time you can eat a snack, a yummy treat. You want to consume about 15 to 20 grams of glucose or simple carbohydrate. So some examples of that would be 4 ounces of juice or regular soda, a tablespoon of sugar or honey, 8 ounces of milk, 2 tablespoons of raisins, some hard candy, or 3 glucose tablets. So what you do is you consume the snack or the drink, you wait about 15 minutes, and you recheck your blood sugar level. And if it is still below 70, you have another snack. You do that up to 2 times. And if your blood sugar does not go up after that, that's when you want to call your doctor or call an ambulance. So just because you have a low blood sugar does not mean you have to go to the ER or go to your doctor. If you catch it in time and you consume a simple carbohydrate and it comes back up, there's no need for you to seek any further care. But what you do want to do is you want to go ahead and eat a meal, because eating the meal will help maintain that blood sugar level. So just remember that. All right, now we're going to talk a little bit about high blood sugar. So early signs and symptoms of high blood sugar are frequent urination, increased thirst, blurred vision, fatigue, and headache. Now, if you catch it early enough, you can usually treat the condition and prevent it from getting further. If the high blood sugar continues, or it continues for a long period of time, or your blood sugar is really high, like above 450, if you're type 2 diabetic, or above 250 if you're type 1 diabetic, if it goes untreated, it can cause toxic acids to build up in your blood and your urine. That's ketones and ketoacidosis, and that's a life-threatening emergency. Usually you have fruity smelling breath, nausea and vomiting, shortness of breath, dry mouth, weakness, confusion, coma, and abdominal pain. So if you have really high blood sugar, you need to go to the ER and to the hospital and get treatment, because they're going to need to give you an insulin infusion to get your blood sugar levels back down. Causes of hyperglycemia: not using enough insulin or diabetes medications, not injecting insulin properly or using expired insulin, not following your diabetes eating plan, meaning like, I'm going to eat my cinnamon roll that makes my blood sugar go 350 for every meal, and then I'm going to be in hyperglycemia. Being inactive, having an illness or infection. Many people that do not take insulin for their diabetes, like I do not take insulin, but I had surgery a few years ago. And when I was in the hospital, my blood sugars were in the 400s. That is actually a very common occurrence. Being in the hospital is a stressor. and stress actually increases your blood sugar levels. So many people that do not take insulin for their diabetes, when they're in the hospital, they are on insulin when they're in the hospital. Usually you do not go home with it though, unless for some reason your blood sugar levels don't come down. So don't get upset if you need insulin when you're in the hospital. You usually, when you go follow up with your doctor after your hospitalization, they take you back off of it. Also, certain medications can cause high blood sugar. Steroids is the biggest one that does. A lot of times people will say they have steroid induced diabetes, which kind of has truth to it. But really what happens if you had the risk factors and the genetic factors for developing diabetes, it might have just been that the steroid was kind of your stress test, meaning it stressed your pancreas enough that it actually caused the diabetes that you probably would have gotten at some point in your life. It just made it happen earlier because the steroids raise your blood sugar level and your pancreas wasn't able to keep up with that attack. So there's not technically, there's no such thing as steroid induced diabetes. It's either diabetes or not, but the steroid was the thing that kind of put you over the edge into developing diabetes. Also being injured or having surgery, like I said, and experiencing emotional stress, such as family conflict or workplace challenges. Stress raises your blood sugar levels. So it's very important to help manage that. So how to treat high blood sugar? Basically, insulin is it. So, if you have type 2 diabetes and you don't use any insulin, if your blood sugar goes high and you've been taking your medicine like you're supposed to, it eventually will come back down. If it does not, that's when you need to call your doctor on how to treat it. But if you have type 1 diabetes and you take insulin, usually your doctor will give you a scale to use if you test your blood sugar and it's high, and it's usually incremental. It's called a sliding scale. Like if you test your blood sugar and it's 250, they might tell you if your blood sugar is 250 to 299, take 4 units of insulin. So usually if you're type 1, you have a way to help prevent your blood sugar from getting any higher. But if you do not and it stays high, that's when you need to also call your doctor or 911 if it's an emergency. So I just want to mention real quickly, I know we're not really in flu season right now, but it'll be here again before we know it. So people with diabetes should get a flu vaccination every fall. People with diabetes, even when well managed, are at risk of serious flu complications, including pneumonia and bronchitis. Flu can also make it harder to manage your blood sugar levels because it could cause your blood sugar levels to rise. But it also can drop your blood sugar levels if you lose your appetite and don't eat. So it's important if you're sick to check your blood sugar regularly. And if you're a person that gets sick, seasonally with the flu or something like that, talk with your doctor about getting a sick day plan so you have instructions on what to do if you're sick, like whether or not you should take your medicine or not, what things you should eat. But the important thing also too is just make sure you stay hydrated. So since we still are in the pandemic area, I also did want to mention a little bit about diabetes and the coronavirus. So I'm sure you all have heard that according to the CDC, older adults and people of any age who have serious underlying medical conditions are at higher risk for severe illness from COVID-19, especially if those medical conditions are not well controlled. So the list of medical conditions is chronic lung disease or moderate to severe asthma, serious heart conditions, immunocompromised state, being overweight or obese, chronic kidney disease undergoing dialysis, liver disease, and diabetes made the list. So actually having diabetes does not make you more susceptible to catching the coronavirus. But if you happen to catch it, you are more likely to suffer from serious symptoms. And you might ask, why is that? So I'm going to hopefully help you understand that. People with diabetes are more susceptible to developing infections because high blood sugar levels weaken our immune system. Hyperglycemia is thought to cause dysfunction of the immune response, which results in failure to control the spread of invading pathogens. Any illness you have raises your blood sugar levels, and uncontrolled diabetes increases your susceptibility to severe illness. Your body spends a lot of energy fighting diabetes. So it is actually less equipped to fight off another threat if you happen to get exposed to a viral infection. Also, many people with diabetes have heart disease, heart failure, are overweight, or have kidney failure. The more diabetes complications you have, unfortunately, exponentially increases your chance of having severe complications from an illness. So, the rule of thumb is just manage your underlying disease processes as best that you can and stay as healthy as you can. So that way, if you are exposed to COVID or the flu or some other viral infection, you'll have a better chance of not having major complications. And of course, wash your hands and all that good stuff. All right, so I'm almost done because I know it's after 5. I don't want to keep everybody past our time.
And Kim, we do have a couple questions when
Okay,
you're ready, so you just let me know.
go
We can
for it.
wait.
That's good. We can do the questions.
Do you want to take those now?
Yes, that's
Okay,
fine.
sure. So the first question is, are eye diseases more common with type 1 or type 2?
Either one, it doesn't matter because it's the high blood sugar that causes the problems. What tends to happen is type 1 is usually diagnosed quicker than type 2. I think I mentioned that earlier. So type 2 ends I'm sorry, I'm getting ahead of myself. With type 1, usually you find out that you have diabetes so that you can start getting your eye exams and preventing the eye issues. With type 2, you're usually already so far progressed with eye issues that you don't know to be preventative to detect them. I hope that makes sense. So you have the chance, the chance is the same in either type diabetes of getting eye problems, but they're probably more prevalent in type 2 just because you don't get diagnosed in time to get ahead of the eye problem. I hope I
Okay,
clarified that.
I think that was clear.
Thank you.
Next question. Someone did ask about the G6 or the Libre, or is
Okay.
it Libre or Libra, which I think
Libre,
we are
yes.
going to be
I
talking
call it
about pretty
Libre, but who knows?
we'll be
Yes.
talking about in an upcoming webinar, but I think you are familiar with those, correct?
Yes, I am. So they are continuous glucose monitors. So they're an alternative to finger sticks. There's a lot involved in those. So I was going to dedicate a whole webinar basically just to those. So just stay tuned.
Yeah.
They're not in themselves accessible, but you can make them accessible with apps. So, well, I think that's going to be my next webinar. So just look out for that and I'll answer your questions to that.
Next question is, how long can it be high before it is a bad thing, such as longer than 2 hours? I guess they're talking about the blood sugar.
Yeah, and that varies. It depends. Usually 2 hours is kind of the threshold because within 2 hours, as long as you're taking your medication like you should, it'll start working and your blood sugar level will come down. The reason that it wouldn't is if, like I said, you're eating cinnamon rolls every time, it's going to stay up. If you're eating way too many carbs, it's going to stay high. And either what needs to happen is you need to stop eating that or your medicine needs to be changed to get your blood sugar level down. With type 2 and you're not taking insulin, your blood sugar should eventually come back down as long as you're taking your medication and drink water and just try to get some activity. With type 1, your blood sugar is not going to come down unless you give yourself insulin. So that's kind of the difference.
Someone says, and I guess this is back when you were talking about some of the foods, what other foods have carbohydrates? That's kind of a loaded question.
Yeah. Okay, so anything from an animal generally has no carbs or very low carbs. So meat has no carbs. It's almost easier to tell you what doesn't have carbs. Meat has no carbs. Dairy products are low carb. They have like 1 or 2 grams per serving. Anything else pretty much has some carbs in it. So fruits have carbs, vegetables have carbs, but it depends on what fruit and vegetable as to whether it's considered a high carb food or a low carb food. Generally, green vegetables are low carb. Corn and potatoes are high carb. Not that you should avoid them because they do have nutritional value, but you should just practice portion control. Don't go overboard eating potatoes because they are considered a starchy vegetable, which means they have 15 grams of carbohydrates or above per serving. Foods that have less than 15 grams of carbohydrates per serving are considered low carb foods. Of course, anything sweet is carbs, bread is carbs, pasta is carbs. I think that's about it. You know, eggs, no carbs. That's pretty much it. I mean, I plan to do like a healthy eating one too. Well, I'll go more into that. But you know, it used to be in the old days, you would get diagnosed with diabetes. I've been teaching about diabetes for about 20 years or so. And you know, 20 years ago, when you got diagnosed with diabetes, you usually met with the dietitian or the doctor or the nurse in the office would do it. And they would say, all right, you can't eat anything white anymore. So no white potatoes, no white bread, no white rice, no biscuits, no pancakes, none of that. And this is what you're going to eat. You're going to have one starch exchange, two protein exchanges, and one fat exchange. And first of all, you're like, what the heck is an exchange? I don't know what any of this stuff is. And it was very, very complicated. It was very regimented. I mean, it was with good intentions. It pretty much wanted to teach you to have a balanced diet of carbs, protein, and fat to help control your blood sugar levels and complications. But it's my belief that it was so complicated that no one really followed it. So then diabetes became this epidemic. So now they have really kind of laid off of that because it is so hard to follow. So there really is no real diabetes diet anymore. There sort of is, but it's not real strict. Basically, what it is you want to healthy eating. So make healthy food choices. We all know what healthy food is: fruits, vegetables, fresh things, you know, as close to nature as you can get. Decrease of processed foods, things like that. You want to do moderation and portion control. So basically, you can eat what you want. You just don't eat a lot of things that are not healthy. So, like, you know, if you want a cookie and you're not going to stop until you get a cookie, don't eat the whole sleeve of Girl Scout cookies. You know, just eat one or two and get it out of your system.
Okay.
Because that won't raise your blood sugar level as much. But overall, make good choices. So less carbs. If you really want to be strict about it, you want to stay between 45 to 60 grams of carbs per meal. So that would mean that you would have to start learning the carbohydrate gram content of the foods that you eat, and, you know, keep track of it, add it up, and no more than 60. For just an example, like for lunch, if you eat a sandwich, a slice of bread generally has about 15 grams of carbs in it. So if you eat a sandwich, you're halfway there. That's 30 grams. So everything else in your lunch needs to be low carb so that you don't cause a great rise in your blood sugar level. So that's it in a nutshell. You know, it's, of course, it's more complicated than that, but it just depends on how intense you want to get about it. I mean, I have people that are carb counting addicts, and they write down everything that they eat and they control their blood sugar that way, and that's how they roll. I tend to be like a type A person, so when I do something like that, it almost causes me more anxiety than it's worth. So I actually switched to doing portion control, moderation, and I ended up losing like 30 pounds because it didn't stress me out. You know, I didn't deprive myself of anything, but when I ate something that I knew I shouldn't have eaten, I just ate a little bit of it. Because what happens with me is I would obsess about it. You know, like I want a Hershey bar. So I knew I shouldn't have it. So I'd eat a whole bunch of other stuff, and then I'd end up eating the Hershey bar anyway. So it ended up like blowing that whole thing out of line. So now what I do is I'll eat some of the Hershey bar and get it out of my system. And then it doesn't have that big effect on me. But like I said, hopefully we'll talk about that in another webinar, because that's a whole other dialogue.
We have a few more questions and we
Okay.
have about 15 minutes
Yes, I know.
left.
I talk too
We're
much. I'm
cruising right.
sorry.
No apologies necessary. It's great information. Couple more related to food, but an earlier question was, um, are the sugar level ranges the same for children and adults?
That is a good question. And you know what? I mostly work with adults. So let me look at my reference and make sure. I believe they're pretty much the same. I'm trying to remember in children, I think it might be a little bit higher range in kids. that you can have your blood sugar level a little bit higher, but please don't quote me on that because, like I said, I work in the adult world. So I'm not real familiar with the pediatric world, but it's generally around the same. And yes, you want their A1C to be below 7 as well. The one time that it is different is the older you get, your A1C level can be around 8%. They
And
give you
Kim,
a little leeway.
would you recommend to people that for specific situations that they consult with a physician?
Yes,
Okay.
because even though the American Diabetes Association recommends that your blood sugar level should be between 80 and 130, if your doctor tells you something different, go with what your doctor says, because that's a general recommendation. There are always special circumstances.
And these diabetic webinars are purely informational purposes only,
Yes,
not
yes.
prescriptive in any way, shape, or form.
Correct. So what I share with you are the recommendations from the American Diabetes Association and the diabetes educators, which are developed by doctors, but again, like I said, they're just general recommendations. So if you have real specific questions about your specific case or someone else's, that's when you need to get it from the doctor's mouth. Yes.
Okay. A couple more questions. Someone said that they got a pre-diabetes back into the normal blood sugar range.
Okay.
Are they at risk for their pancreas to stop doing its job? Are they at a higher risk?
Yes, but it might be a really long time before it happens. What usually happens, and I don't know your specific circumstance, but if you are told that you're pre-diabetic, the way to get out of that is to change your lifestyle. So what happens is you change your lifestyle and you're no longer pre-diabetic. But if you ever fall off the wagon and once again start to live an unhealthy life, you'll go right back to pre-diabetes and maybe diabetes. So you know that you have the warning sign there that if you don't continually manage your lifestyle, you will probably move into the type 2 diabetes world. So keep doing what you're doing so you don't get it.
All right. Next question. Are sugar-free items in general good to eat?
Okay, so this is my opinion only from the research I have done. I personally am not a fan of sugar free foods because there are two things in foods that give it flavor: sugar and fat. So when they take sugar out of a product, they put fat in. And since cardiovascular disease is the number one complication of diabetes, all you're doing is giving yourself a worse chance of having cardiovascular problems because you're increasing your fat intake. Once again, if they take fat out of something, they put sugar in. So my opinion is if you're going to eat something, just eat the normal whatever of it.
Mm, okay.
So that you're not substituting one bad thing for another, just, in moderation.
Yeah.
Plus, sugar free items, they usually have sugar alcohols in them, and sugar alcohol has a very strong laxative effect. So if you happen to eat too much of something sugar free, you'll never forget it because you'll be in the bathroom. Yes.
Okay, and the last question we have so far is how does the medical community feel about counting net carbs?
Net carbs. I'm assuming you mean because, like on nutrition labels, they have total carbohydrates and then underneath it, they have sugars and fiber. So on nutrition labels, they consider fiber a carbohydrate. If you are truly counting your carbs, you would count net carbs, meaning you would subtract the grams of fiber from the total carb amount on the nutrition label. So if a nutrition label says total carbs 30, fiber 5 grams, that product actually has 25 grams of carbs.
All right,
Yep.
that's all the questions, and
All
you
right.
still have about 10 minutes if you want to
Good.
continue.
Yeah. And I'm almost done. And then if there's any more,
Awesome.
hopefully, I told you I talk a lot, so I'm sorry.
No, this is great. No
All right.
apologies.
So these are just some general diabetes management tips. The first and most important thing is it is up to you to make a commitment to manage your diabetes. Your doctor can't do it for you. Your spouse can't do it for you. Your family can't do it for you. You are the only one that can manage your diabetes. So find whatever in yourself makes you do it. My goal is that everyone is empowered to do it themselves, especially if you have a barrier like a vision impairment. There are ways you can manage it. And that's what I hope to show everyone with these series of webinars that I'm doing. Don't smoke. You know, diabetes already affects the oxygen carrying capacity of your blood, and smoking does as well. So it's just a double whammy. There is a free resource. It's 1-800-QUIT-NOW. You don't even have to give them your name. You can call up and make a name. It's confidential. They provide counseling. So, like, if you have the urge for a cigarette, call 1-800-QUIT-NOW and they'll talk you down. They also give you access to smoking cessation aids. So that's a great resource to have. Make sure you visit your doctor at least every 6 months for a diabetes checkup so you can stay ahead of complications. You know, the doctor will draw labs for your kidney function, you know, your cholesterol levels, things like that. So you stay ahead of any potential problematic complications. Take care of your teeth. Even if you don't, you know, it's really good for you to go to the dentist every 6 months for cleaning. But if you are unable to do that, at least brush and floss your teeth twice a day if you can, because gum infections you're at much higher risk for gum infections with diabetes. Keep your vaccinations up to date, whatever your doctor recommends. And like I said, pay attention to your feet. You want to prevent a problem with foot ulcers and amputations before it starts. You also want to establish a daily routine. This kind of means you want to kind of go to bed at the same time, wake up at the same time every day, eat at about the same time. Your body craves a schedule, and it does better dealing with chronic conditions when you have a schedule. So I don't know if you ever notice, I still do this, and I'm still, you know, learning in process. You know, I work Monday through Friday, so I tend to get up at the same time, eat my meals at the same time, and go to bed at the same time. But I love sleep. So, you know, on Saturday, I'll sleep in, and every weekend I feel horrible because I overslept. I didn't take my medicine at the same time. I didn't eat at the same time as I had Monday through Friday. And it takes me the whole weekend to get myself straight. You think I'd learn, but like I said, you know, denial is a wonderful place sometimes. So do yourself a favor, establish a daily routine. You also want to practice stress management and get enough sleep. Stress raises your blood sugar levels. So whatever you can do, you know, meditation, yoga, praying, singing, listening to music, a hobby, whatever helps control your stress, make that part of your daily life. Also, take your medications as prescribed by your doctor. If you can't, let your doctor know. If you don't like the side effects of a medication, so it makes you not want to take them, let your doctor know. There are like 68 medications for diabetes now. You know, in the old days, there were like 4. So you were stuck with whatever there was. But if you have an issue, please let them know. Also, if you can't afford them, please let your doctor know. Part of what I'm going to do when I go over diabetes medications, I have some resources for saving money. I know one of the medications I take costs about $1,800 a month. And if I did not have health insurance, I would not be taking it. So I know it's very difficult sometimes if you don't have health insurance to get the medications that you need. So hopefully when I do that one, you'll find some resources for that. Also, if your doctor wants you to take your blood glucose levels at home with a meter, do that. You want to exercise regularly. The standard is 150 minutes each week. So even if you can only do 30 minutes, 5 days a week, that's 150 minutes. The point is just don't be a couch potato. You know, even if you're listening to a show or listening to an audiobook or watching a show or whatever you're doing, at least every hour, stand up, you know, walk in place, walk around the couch, something just to get the circulation moving and get some kind of activity. I call them exercise snacks. They add up. Any kind of activity you get does add up to equal that 150 minutes. And healthy eating. I remember I said balance, moderation, and portion control, and we'll discuss that further in another webinar, but that's the main key. Accessible resources. So everyone got a link to some of the accessible resources. Most of them are apps or web pages that you can use, you know, with screen readers or JAWS or VoiceOver on your iPhone or TalkBack on an Android phone. Not every part of the app is accessible. Like if there's graphs or something like that, most of the screen reading accessibility options will not read those things. but I have had success with people getting a lot of information out of those. So I ran out of time to go over all of those individually, but basically there are some apps that help you manage your blood sugar levels. And then there are some apps to help motivate you to exercise and track your exercise. And then there's also some audio resources that you can click the link on, and it will take you to either a video or a talk about diabetes. And there's some basic yoga. It is audio descriptive yoga sessions to help with stress management. So I hope you're able to find some of those resources helpful. Of course, it's not an all-inclusive list. I did update it to get rid of all the ones that did, the links didn't work anymore. And I'm sure there's more out there. And I'll probably do a second one later as I get a chance to do that. But I did want to do one with you. It is called Sully the Diabetes Guru. And I think it's like really cool because you can ask it any question you want. So it's on Alexa or Google Assistant. So I'm going to bring Alexa up here and we'll see if she will cooperate with us so you can see what this is like. Hey, Alexa, open Sully the Diabetes Guru.
Sorry, I'm having trouble accessing your Sully the Diabetes Guru skill right now.
Why, Alexa? All right. Hey, Alexa, open Sully the Diabetes Guru.
Sorry, I'm having trouble accessing your Sully the Diabetes Guru skill right now.
Okay, I'm really mad at Alexa right now. Basically, it worked yesterday when I did it. So it's Sully the Diabetes Guru. You open it through Alexa and you can ask her any question you want. Like I asked, what is high blood sugar? And it will tell you the definition of high blood sugar and what that means in a lab value. So it's a really cool resource. And if you have a question about carbohydrate content in a food, it'll answer that. So I like it that it's easy. If you have an Amazon Echo, which I have an Echo, but I also have Alexa on my phone, or you have Google Assistant, you can use it with that when Alexa wants to cooperate with you. So, of course, something had to go wrong during this whole webinar, and I guess Alexa.
Oh, that's minor. That's nothing. Hopefully
I
everybody
invited
can take advantage of that.
529.
Yeah.
Well, thank you
You're welcome. So I'm going to
so
stop
much,
talking, and
Kim.
I hope to see y'all at our future webinars.
And we will be having webinars every other month. So our next one will be in June. We don't have a specific date yet, but stay tuned. You will start to receive emails from us each Wednesday after you participate in a webinar. You're added to our email list. And so we have one coming out tomorrow with all our upcoming webinars and more information for you. Again, if you want to learn more about our webinars or the calendar of events, you can check our website out at aphconnectcenter.org / or just aphconnectcenter.org as it is in the chat. And from there, you can access all sorts of stuff, our webinars, our calendar of events, our directory of services. So please take advantage of those. We also archive our webinars. So if you want to check out the first diabetes webinar and this one in a few days will be posted, you can do that there as well. So again, I just want to thank you, and we will go ahead and stop the recording now.